Beth is an expert in using cannabidiol or CBD and also THC for your health, and she has some personal experience with this. I actually met Beth back a couple years ago at GW with Dr. Misha Kogan, who's holding a conference there on integrative medicine for the underserved. I believe that was the conference, and I think you were talking there about using CBD and THC for your health, and really just a wealth of knowledge on this topic, and it's been working with us for a long time now. And really, I think maybe you can talk about that, Beth. But welcome, Beth. Thank you so much for coming on today.
Thank you for having me.
Yes, and so we are going to just run through a couple of community updates from the clinic first. We have a Facebook group. I hope everyone can join that. If you're on Facebook, it's down here called CIH Community, and it's a private Facebook group. We talk about health and wellness on there a lot. We have patients, we have clinicians, we have community members all across the world now that are on this site. We're close to about 1,000 people on this site now. So very excited to just keep on sharing that and kind of sharing our knowledge and all together exchanging, information and learning together. And then Jen and I are going to be doing a brain health series, which is going to be starting next June 8th. So every Tuesday, basically from 1 to 2 p.m. And if you were on last week, you heard this already, but we'll just repeat for those who are not on here. Welcome again. We are going to be talking about anxiety in group visits, also depression, cognitive decline. So this is our brain health series for this month. And then a bonus thyroid group visit on June 29th. These are built to insurance. There's an interest form in the chat box that Jen is putting up. So just click that if you're interested in it, and we will be contacting you there for that. Brain is a very important, and I do think for the hemp plant, for cannabidiol receptors in general, the brain is a hugely important, organ, of course, and it's affecting all other organs, their whole body, mind, spirit, essentially. So, brain health, I feel like this is kind of a preview of all the different things we're doing in brain health today. We're talking about CBD and THC and why that's so important to look at that endocannabinoid system and optimize that, which is what we're talking about today. So later this month, can't believe it's June already, actually, but next week we have Iris, who's our friend in reflexology here, that is talking about reflexology and health. We have Jade and Shannon back on from Cacao Conscious, which they're always having great presentations and yoga experiences there. We're talking about yoga. And then we have a CH reunion, which we call it CH reunion. A lot of you haven't seen us in person for a long time. We hope to see you in person in the clinic soon. We're going to have some of our clinicians on here and just kind of meet and greet again, re-meet and greet in a way, and just chat with you about how things are going. So that's what's happening this month. Really excited for this whole lineup here. And then now I'm going to turn it over to Beth here. Thank you so much again, Beth, for coming on today. And then I gave you a little bit of introduction, but I think that probably doesn't totally do you justice to that. So if you want to talk a bit more about your experiences with CBD and THC for your health, that would be so great.
So much for having me today. I love talking about THC and CBD. Cannabis has saved my health and allowed me to live well beyond what my doctors expected. If you bear with me, I'm going to load up my presentation. So this is my Instagram page, and I'm going to be loading these slides onto there. So if you want to take a better look at them later, feel free. I also welcome anybody to take any screenshots of information that is a little too complicated to grasp during this presentation. So I can, there we go. So I use cannabis for my Crohn's disease. I used to be extremely sick, and Crohn's is an inflammation of the digestive tract and joints, resulting in pain and dysfunction. I was personally on dozens of drugs and hospitalized every 3 months, having surgery annually with a 5-year life expectancy. So I started smoking to alleviate the belly cramps, and I did that for years. Then I went to Colorado to see if there was something that worked a little bit better for me, and was introduced to edibles. So I began eating like brownies and then capsules regularly. And when I was putting it in my stomach, directly in my stomach, it settled my tummy down for longer periods of time than just smoking it. When I add suppositories to my routine, I experienced remission from Crohn's disease for the first time in a decade. I canceled the next surgery that I was scheduled for, and I stopped taking the shots and the pills that I'd taken for Crohn's for 15 years, and have been in remission ever since. And then one day I was cooking up the oil for my edibles, and I spilled some oil. And when I cleaned it up, I didn't want to eat it, so I just like rubbed it into my leg, thinking I would moisturize my leg. And the frozen knee that I'd had for years softened up. So I began rubbing cannabis into my sore joints regularly and experimented with a few formulas, found that doing a combination of THC and CBD worked the best. And after a year, I no longer had like screaming joints every morning from the rheumatoid arthritis that developed from the Crohn's disease. So I've been in remission of Crohn's for 5 years now, but I didn't stop there. I used cannabis for sleep. I use it still for sleep, for restless legs, panic attacks, PMS cramps, skin inflammation, bug bites, acne, sunburn, chapped lips. I went from 33 prescriptions to 0 in 2 years and have been off of prescription drugs for 4 years now. So today I want to give you enough information to get you started on your own cannabis medicine adventure. First, I'm going to discuss the various forms cannabis medicine comes in and how they are used. I'm going at this assuming that, you know, maybe you've used one product, but even if you haven't used any, I'm going to get you caught up from 0 today. And then I'm going to talk about how CBD and THC work and the endocannabinoid system. And last, I'm going to teach you about dosing and how to read the labels in your cannabis store. So really how to go and get this stuff. So cannabis medicine is used in a variety of ways, but it's most commonly encountered in its smokable form. The flowers from the plants that are also called buds. The buds are harvested and cured similarly to like chamomile or any other dried herb. These tight cones of tiny leaves are covered in sticky trichomes, which kind of look like little Dr. Seuss forests that you can see over on the right-hand side. And these trichomes produce a sap-like oil. That oil is made up of the medicinal molecules that are called molecules that only the cannabis plant can make. There's over 100 of these, and the superstars are the well-known tetrahydrocannabinol, otherwise known as THC, and cannabidiol or CBD or cannabidiol. So I'm going to talk more about those specifically later. Right now, we're going to talk about how those cannabinoids can be used. So when inhaled, cannabis acts really quickly, and in 5 minutes, you have that full effect. To smoke cannabis, folks grind up the buds into smaller particles and roll that into a joint or pack it into a pipe. And pipes that have water in them are called bongs. People use bongs. They're very, very popular because they filter a little bit of that cannabis out. So it makes it a little easier to smoke. But the vaporizers are the alternative to smoking that a lot of people use when they're using cannabis products for their health. It's the safest method for inhaling your cannabis medicine. And the way that you use them is you pack the ground flowers into this little heating bowl, and the device warms the cannabis flower up to the temperature where the oil becomes vapor. They can be small, like this little metal thing you see called packs. And that's handheld, or they can be really large with these balloons that are filled up with vapor. The device you see there is called a volcano. It's the most common vaporizer. It's been around for decades. And then you remove the balloon and inhale it from the balloon. And this method is so, like low impact that in the hospitals that allow cannabis use, which are very few and far between, this is the method of inhalation that's allowed in the hospital. In the dispensary, you'll also see little jars of brown goo and honey and black tar and like syringes of this stuff. And then like even stuff that looks kind of like earwax. And these products are called concentrates or extracts. They are cannabinoids that were removed from or extracted from the flowers. So those little trichomes that we saw, little Dr. Seuss forests with the oil in them, those are kind of scraped off or extracted with liquids. And the leaf and the stem have been removed from the oil, leaving behind a gooey substance it's a concentrated oil. The extracts are used by some consumers who want to inhale a really large dose all at once, called a dab. It's called a dab because you only need like a little tiny bit, a little dab of this concentrate to get a large, fast effect. Um, so there's also another product that you'll see in stores called vape pen. And these are not to be confused with vaporizers. It's a very different thing. These are taking that oil that I was just talking about and vaporizing it directly. Whereas the vaporizers I was talking about before, vape the herb. Vape pens deliver a really strong dose of oil concentrate, and and so it heats the oil and delivers like 5 times as much medicine in one inhaled dose as an herbal vaporizer can. When you see carts on the dispensary menu or you hear about carts, these are the cartridges that go on the vape pens. And the cartridges can have CBD, THC, or a combination of them. They're really, really popular with recreational users, but they're also popular with people who need high doses of inhaled cannabis in an emergency way or regularly and discreetly. They're very, very discreet. So these inhalation methods, they get the cannabinoids into your brain very, very quickly. They're really good for using cannabis to treat acute pain and pain that topicals don't help, and also mental distress, like a panic attack or for insomnia, which is what I personally use them for. And because I use cannabis in my stomach for my Crohn's disease, I tend to use it. I inhale it for other things that I want to address so that I'm not messing up my stomach with a different dose. And also, when you smoke, the effect comes on really quickly, but it also is the first effect to leave. So it stays for about 2 to 4 hours. Tinctures are a really great alternative to smoking if you don't want to smoke. And they're available like everywhere now. They're really widely available. You can get them in stores, you can get CBD ones online, and it's the closest thing to smoking when you let it absorb under your tongue for a minute before swallowing it. This little diagram shows the sublingual gland, which is a gland that's right underneath your tongue. And when you let that tincture really absorb underneath your tongue, then it soaks into that artery to get the cannabinoids to absorb into your bloodstream and up into your head, as quickly as as quickly as it can go when it's in a tincture. So they can be oil, they can be alcohol or glycerin. I highly recommend sticking with the oil. For one reason, because alcohol has its own problems. Glycerin is a diuretic, so it can affect your stomach negatively, but also because an oil tincture can be used topically. And I'll get into that a little bit later. But often tinctures that you find are stronger than topicals that you find in the store. So if you have a lot of pain, you're looking to use cannabis topically, I recommend looking into getting some tinctures. The next thing that we're looking at is edibles, which are really, really popular with people that don't like to smoke. Personally, I recommend the tinctures. It's easier to dose and there's no sugar and fat, or there's a little bit of fat delivering, but it's not, like eating a brownie. They tend to have a lot of sugar and fat in them, and they're not ideal for folks who need to take medicine frequently. I say that instead of that, if you don't like the tincture, if you don't like how it feels in your mouth or something, look for capsules. You can still have a brownie if you want. Just take it with your capsule if you really want a brownie. If you eat some THC and it gives you the munchies, you definitely want to avoid eating any edibles when you have your munchies. Like, don't compound your intoxication, because taking too much can lead to an unpleasant experience with nausea and sometimes even hallucinations. The good is you can die taking too much cannabis. An overdose is just going to leave you a little dysphoric, like, you know, you might get a little dizzy and have extreme munchies and stuff, just drink a bunch of water, go to sleep. That's all that you need to do in order to deal with a cannabis overdose is go to sleep, you'll wake up, you'll be fine. Don't take CBD to deal with a THC cannabis overdose. That is some misinformation that went around a while ago, and it'll just prolong the high for reasons I won't get into today. But don't take CBD to try to cancel your high. You have to take it beforehand. So there's also a really wide variety of ways to apply cannabis to and through the skin, and those are called topicals. Topicals, they don't usually get you high unless you use something extremely strong or you're a very, very sensitive user. I have seen it. It's very rare. It's hard to do. Balms and lotions are really helpful for skin conditions, and really strong formulas attack muscle and joint pain. So when using cannabis to treat pain, always, always, always try applying it topically where you're experiencing pain first. When you inhale cannabis, it goes into your brain first, and then it goes into the rest of your body. And really, you're getting the sensation of pain taken care of, but the inflammatory activity that's going on that's causing that pain is not getting addressed well by smoking it as well as you can by using it topically. And another topical application is patches. They're not available in every dispensary, but they're more and more common, so keep looking for them. Mary's Medicinals is the most common brand, and you'll see those in the CBD stores. And they basically work the same way that a nicotine patch does, or a fentanyl patch, where the medicine is supposed to get into your bloodstream and have a similar effect to smoking. There's also transdermal gels. Transdermal just means that it's going through your skin, through your skin. And they work just better locally. So if you have some local pain and a topical isn't doing the trick for you, then the transdermal ones get in there just a little bit more deeply. So the other form of applying cannabis to you, and one of my very favorites, is suppositories. They can be really hard to find, but they're really great for local pain in the pelvis or the rectum, like if you have sciatica or cramps or hemorrhoids. Make sure that they don't contain any beeswax because they don't melt very, very well. And I personally prefer cocoa butter based suppositories. And because the glycerin ones, they promote an extra bowel movement, which CBD tends to do anyway. And with Crohn's disease, that's not what I need. I use low dose THC suppositories for my Crohn's disease, between 2 and 5 milligrams. Slows down my digestion. And I also use a low dose vaginally when I get cramps at my time of the month. So now that we know all the ways that cannabis plant can be applied, let's take a little closer look at what's in it. This guy down here that I met a couple of years ago is Dr. Raphael Mechoulam. He's the godfather of cannabis research, and he was the first to isolate the THC molecule when he and a bunch of scientists in Israel were looking at the pot plant and trying to figure out how it got you high. What was the molecule that got you high? So there were over 500 molecules in the plant, and he only found that THC was the one that was really intoxicating. THC does this by mimicking a molecule in the body called anandamide. The name anandamide means the bliss molecule. And molecules like anandamide are called endocannabinoids because and they live on the cannabis plant. And cannabinoids like THC are powerful because they act on the system in this thing. THC wouldn't be able to come in and THC works like a key in a lock of a cell. And if you don't have a cell that has that lock formation that fits that key well, that molecule isn't going to do anything at all. So THC can do what it does because anandamide does what it does. And I highly recommend anybody interested in cannabis science and like, how does this cannabis plant do so much in our body? Look into anandamide. Just look up the Wikipedia page on anandamide. There's tons of information. This lady down here is Aileen Howlett. She's the godmother of endocannabinoid research. She discovered this system of receptors in 1988. So this is a fairly new body of research, the endocannabinoid system, and it's only recently getting taught in medical schools. So if your doctor hasn't heard of it yet, not his fault. He wasn't educated about it in school. Let's see, endocannabinoids control things like the sensation of pain, your appetite, memory, and inflammation. And so these are some of the things that THC you have a lot of chronic pain. Sometimes just that memory of pain can be a pain in itself. There are painful memories from PTSD. So there is a lot of area where memory is not great when it comes to pain, and that cannabis can help with that. So the things that THC are known to affect, those are the places where anandamide goes to. And some of us have weak endocannabinoid systems, right? Our bodies don't regulate inflammation well, and we get autoimmune illnesses. So the Crohn's disease that I have, that's what's listed in this chart pulled from an article. It's inflammation of the digestive tract and joints. And it means that I don't make enough anandamide. I make too much of the enzyme that breaks down anandamide, and I don't have enough of the receptors that allow anandamide, even if I did have it, even if I did make it well, to regulate my inflammation. So I suck at having an endocannabinoid system. And that's why I supplement my system with THC. For me, THC is insulin, and that's the real takeaway. For somebody with an inflammation problem, THC can be like insulin. Now, some people make enough endocannabinoids, but they make too much of the enzymes that break the molecules like anandamide down. That the FA enzyme, which is short for fatty acids, when you make extra FA, you make extra FA in stressful conditions. So when you're physically or emotionally stressed, you churn out a lot of extra FA, and that FA eats up the anandamide, and your endocannabinoid system tone goes down. CBD stops the endocannabinoid breaking enzyme FA. It stops it in its tracks. So when used as needed, CBD leaves more anandamide around to reduce inflammation and stress. THC replaces anandamide, but CBD inhibits the enzyme that breaks down anandamide. Kind of, if you know how SSRI works, it's like how an SSRI works. So CBD can also interrupt anandamide and THC signals. It can get sticky, and it can get sticky in the receptors that anandamide THC go to. So you have to be careful about how much you use it, and just make sure that it's not making you feel worse. Pay attention to how it affects you. It's very, very individual. Some people, like me, I used it for a long time, and then it stopped working so well for me. So just, keep in touch with your medications. And treat it like any other medication that you would use that's effective. Just keep an eye on it. CBD's only been around for a few years, so we're still learning how it works, but we do know that it affects a lot of receptors and enzymes, and it blocks the same enzymes as grapefruit juice. So importantly, if you have a grapefruit juice warning on your medication, you should not eat CBD. Project CBD is a really great resource for up-to-date information and research on CBD. And I highly recommend that you go to it. There's a ton of information on there, but it has a really, really good search functionality. So as we're still learning how it works and who it's good of you may be familiar with the story Sanjay Gupta told about the little girl, Charlotte Figge from Colorado. She was born with Dravet syndrome, and by 5 years old, Charlotte suffered multiple grand mal seizures every day. And she was so debilitated, she was in a wheelchair. Her parents had heard that cannabis can help, but they were concerned about their little girl getting high. But when they were at the end of their road with pharmaceuticals, they visited the five Stanley brothers who grew a cultivar called Hippie's Disappointment. Um, and I mean, you can tell why it's called Hippie. It just didn't get anybody high. So Charlotte never got high from it, and her seizures went from 300 a week to 3 a month. So the Stanley brothers renamed their cultivar after her, Charlotte's Web. And when it was tested for cannabinoid content, a high level of CBD was revealed, and the credit for the reduction of her seizures was given to CBD. Charlotte's Web became the first CBD rich cultivar. And so Charlotte lived to be 13 years old, far surpassing her life expectancy. Unfortunately, she passed last April of COVID. But CBD was a miracle for Charlotte. There's foundations in her name. And if you're interested, I highly encourage you to go and donate to those foundations to help other families like Charlotte's. But even though we do have some research on CBD, scientists are really still trying to sort out how it helps seizures. There's theories about it working on GABA receptors and serotonin receptors and vanilloid receptors, but really the jury's still out. We're still looking into it. We're still learning about it. We do know that it's not the FAAH enzyme inhibition that helps the seizures, but we're not exactly sure exactly where it's acting that it is doing that. So now that you have an idea about the cannabis medicine that you want to try, what's in it and how it's delivered, let's talk about how these things look at the store, which can be a very overwhelming experience if you're a recreational cannabis user. It's a kid in a candy store, quite literally, because there's candy all over the place. But if you're a medical user and you're looking for some relief, it can get a little overwhelming. So I recommend downloading one of these apps. The Weed Maps is the WM, or Leafly, and just scrolling through and looking at the stores and the menus of the stores that are in your area to see what you have available, and to just get an idea of what's in there before you go in there. I promise you that the FBI is not watching your phone after you download one of these apps. Nobody cares. Feel free to download it. It's totally safe. Promise, promise, promise. So when you go into the dispensary, and these are just like some sample menus from the Weed Maps dispensary menu. So when you go into the dispensary, there's cannabis flower to buy. Sometimes it's in little displays that you can sniff it. That went out of style during COVID, but I've seen it come back a little bit. When you select a cultivar, you're going to find the percentage of THC or CBD by weight on the label. So some of the cultivars make up as much as 30%, like the cannabis weight is up to 30% on there, and some are as low as 12%. So you think of these percentages just like you would think of an alcohol proof. The higher the number, the more potent and the less it takes to get a desired effect. But not everybody is looking for just the highest percentage of alcohol, or people would be drinking moonshine all the time, and wine has been around for a long time. So people have different preferences as far as how strong that they like their cannabis to be. The cannabis plants that make only a trace amount of THC and a lot of CBD are hemp plants. And the hemp plants are, they used to actually only be grown for agricultural purposes like fiber and oil. And as seen on the right, they look like bamboo. Then Charlotte inspired the CBD revolution, and the plants were cultivated to produce the more cannabinoid rich flowers that you see in the middle and on the left. In CBD stores, you're going to see a lot of hemp products, including like shoes and building materials called hempcrete, which is amazing. Highly recommend looking into hempcrete. You're also going to see hemp oil, which has its own medicinal properties. It's good stuff. It tastes a little rough, not going to lie, but it's really rich in omega fatty acids, really, really good omega fatty acids. However, it has no cannabinoids. It comes from the seed and the stalk of the plants, not the flowers, where that resin is, where those trichomes are. So you just want to look out, because some online hemp oil sellers are intentionally trying to sell hemp oil, and they're trying to confuse you into buying it when you're looking for CBD. So just make sure that you see some kind of CBD milligrams on the label. So most of the cultivars in a dispensary, cultivars are just types of cannabis plants, varieties of cannabis plant. You might hear strains. Strain is, it's like scientifically inaccurate. That's really more of a bacteria or a virus. Cultivar is more accurate, but strain is fine. Don't correct your bud tender. It's fine. Nobody's going to die if you use the word strain. I prefer the word cultivar. So most of the cultivars in the dispensary have little to no CBD in them, but some of them will be CBD rich, like cannatonic. And that one has a ratio of THC to CBD on the label. This cannatonic in the middle there, the pink represents the CBD and the green, the THC. So it has a 2-to-1 ratio. For every 2 CBD molecules, there's 1 THC molecule. This ratio determines the effects of the combination, as THC and CBD, as we talked about, they act very, very differently in your body. And each plant has its own unique ratio of molecules that it makes, creating unique. So there's over 100 cannabinoids. So the strain print is a lot more than THC and CBD. That's just what we're touching on today. I encourage you to look into the other cannabinoid. But another element of difference between the cultivars is the terpene content. Terpenes are the scent molecules that all plants make, not just cannabis plants. And at a dispensary, you're going to see THC flowers and products labeled as indica or sativa or hybrid. And these labels can actually be read as shorthand for the terpene content in each cultivar that changes how the THC feels. So when you have the terpenes, and you can see some of them up here, and the way that they can make you feel, they kind of augment the effects of the THC or the CBD that you're inhaling. There's dozens of them, and getting to know the scents that match the feel that you want is a real important part of dialing in your cannabis medicine therapy. One of the terpenes in there is lavender. Is linalool, which is a terpene that's shared with lavender, and this or relaxing dispensary. You're really not going to see terpenes labeled. You'll usually see indica or sativa. And to remember which one has the relaxing terpenes over the more energizing terpenes, indica can be remembered as inda couch, like you're sinking into the couch and relaxing. So again, the indicas are useful for sleep and reducing neuropathic pain. Linalool is a great indica terpene, as is geraniol and myrcene. So in contrast, we have sativas, and sativas are more uplifting and energizing. And they have terpenes like pinene, which is my favorite terpene. And pinene's my favorite because it's a bronchodilator. I have asthma, and when I smoke cannabis, I need a strain, I need a cultivar. I even say strain sometimes. I need a cultivar that's high in pinene in order to alleviate some of the stress that smoking can put on my asthmatic lungs. So when I balance the smoking with putting a little pinene in there, or having a little pinene in there, from a sativa strain that smells, it's going to smell a little Christmassy, right? Then it helps my lungs to absorb it a little bit better. Pinene also reduces some of the memory reducing effects of cannabis, so it can counteract some of the memory impairment. And sativa cultivars tend to be popular for use during the day, whereas the indicas tend to be popular for use at night. You're also going to see sativa and indica on edibles. I don't find that it makes much of a difference, but that's where to keep that in mind. And then the third category that you'll see is hybrid, and hybrid just means it's a combination of sativa and indica. They've taken an indica plant and a sativa plant and they made babies with it, and now you have a hybrid. And those hybrids sometimes have a ratio on them that's kind of confusing because it's not the CBD THC ratio, it's the hybrid ratio, and it'll say like indica or sativa ratio. So if you have a 2-to-1 indica ratio, it means that it comes from a lineage of twice as many indica plants as sativa plants. The long and short of it is that you've got terpenes in there that you want to be familiar with which terpenes give you the effect that you like the most. And so what I recommend doing is, if you're inhaling cannabis, I recommend getting small amounts of flowers. You can get like a gram at a time that all smell different. So even if they don't have labels of the terpenes on them or anything, you can just smell them and tell that they're different. There's something different going on. And sit down with a chart of terpenes like this one and see if you can smell which ones are in there. When you inhale them, just note which one has the best effect for you. And as if with trying any new therapy, journaling your experience doing any of this cannabis medicine is really going to help you determine what works best among all these options. Lots of options. Journal it, keep writing it down is going to be your best friend. Personally, I like of each type of pain that I experience with its own 1 to 10 score and check in on the hour when I'm trying a brand new treatment. I just want to make sure that it's working for me and that it's worth the investment that I've done. So when you're getting a CBD product, there's 2 types of CBD products, other than the ones that, have the different stuff. When it's just a pure product at a CBD store, one type is made with isolated CBD molecules, and it's called isolate. It's made out of that. You can see that white powder. It does look suspiciously a lot like some other drugs. All the other hundreds of molecules that are in the cannabis plant, they've all been removed. And all that's left is that white crystalline powder CBD molecule. That's all that remains. And in products, this is called pure CBD or 100% THC free. So that's not going to have any trace amounts of THC or any of the other phytocannabinoids or any of the terpenes in it unless things are added back in. On the other hand, you have the whole plant or full spectrum products, and they have a trace amount of THC in them. If you find that a large dose, and a lot of people find that the whole plant products work a lot better than the isolate-based products, and that you have to use a lot more isolate-based products to get the effect of the whole plant product. But if you're using a lot of whole plant CBD, I encourage you to check to see if maybe you're just microdosing THC. A friend of mine is a 45-year-old man using 50 milligrams of CBD every morning to alleviate constipation and stress, but he kept getting really drowsy from it. And since he was getting 1 full milligram of THC in the CBD, he tried 1 milligram of THC alone without the CBD, had the same positive effects without the sedation. And I mean, that taking 1 milligram is a lot cheaper than taking 50 milligrams every day. So there can be a lot of benefits to doing a microdose. And I actually encourage people to start off with a microdose of both cannabinoids before going into the heavier doses of either one. So when you're in the cannabis store, it's kind of like going to a pharmacist. Guide you and advise you generally, but you should be aware of what you are looking for to try and be able to read the labels and know what it is that you're getting. The bud tender is not getting paid as much as the pharmacist and doesn't have anywhere near the education. So go in there with some good idea as to what it is that you're looking for, what it is that you want to try, and try to familiarize yourself with the labels so that you know what you're reading. These are an example of some of the labels you see, a lot of percentages and milligrams and whatnot. Just keep reading, keep familiarizing yourself, and you'll get there. So the first time that you start, when you eat cannabis or use a tincture, start with 2 to 3 milligrams. The very first time that you try it, if you've never used any of it before, CBD or THC, 2 to 3 milligrams. You can even start with 1 milligram, but that's a really hard dose to find. So this is extremely that small dose. So you don't know 2 to 3 milligrams a try and give it a full day. The tincture effects usually start in 5 to 20 minutes and fully kick in an hour. When you eat it, the effects can take up to an hour to feel. Even to get the full effects of eating it can take up to 2 hours to kick in. In some rare people, like 1 out of 100 people that I came across, THC doesn't give them any effect for 4 full hours. And then all of a sudden it hits them. So you really want to start low and go slow while you're getting to know this stuff, and avoid having, too much and an unpleasant experience. If you don't have any effect from those 2 or 3 milligrams that first day, then the next day try 5 milligrams. And on the third day, you can try 10. Fourth day, see how, 20, and then 30, then 50, then 100. If you have no effect from 100 milligrams, try a different brand of cannabis. Not all cannabis products are made in a way that delivers the medicine effectively. So like I've had candy bars that had like 1,000 milligrams in them and got nothing out of it. And so you really, if you're not getting anything from it, just try a different brand, try a different manufacturer. And with the new brands, start back at 10 milligrams and go up from there. Tincture bottles usually tell you how many milligrams of cannabinoids are in a drop or in a full squeeze of the dropper. If they don't, again, look for another brand. There's tons of brands, especially of CBD out there. Just look for another brand. If they're not clearly labeling what's in there, forget them. If you take too much, the effects can be unpleasant, from nausea or hallucinations. So the key phrase to remember is start low, go slow. And if you're going to inhale your cannabis, you can take 1 puff and see how it affects you, waiting 5 minutes between inhales. It's much harder to oversmoke than it is to overeat cannabis because the full effect comes on so quickly. The last product we're going to talk about as we wrap this up is topicals, and they're really, really difficult to figure out how strong they are in the store. As a baseline, you want to check for at least 300 milligrams per ounce. And so if you have a ½ ounce bottle, then you're looking at 150 milligrams. The bottles might be labeled in milliliters, and in that you want at least 10 milligrams per milliliter. When you apply a topical, if it's not strong enough, you can't just take more because the skin gets saturated. So if you have something weaker than this, it's not going to do a whole lot, except for like bug bites and some skin conditions. So you want to find something with a strong enough concentration. If you can't find a topical in your store with a strong enough concentration, as I said before, tinctures, oil-based tinctures, awesome way to go. Very strong. They tend to be that 300 milligrams strength. So go for that. The topicals are amazing. They can be used. This on the right-hand side is a friend of mine with psoriasis, and he experienced complete remission using cannabis topically in lotion and a soap. He used THC directly on his psoriasis. It also works on sunburn and insect bites and hives. THC and CBD combined, I found to be most effective for joint, muscle, and foot pain. I did a lot of tests on this on myself, and especially for foot pain, the combination of the two is much better. And the very last vocabulary that I'm going to leave you with today is the first pass effect. This means that wherever you put cannabis, the location to enter your body at is where you're going to get the strongest effect. So if nothing else, if you remember nothing else from this, remember to put cannabis where you need it to get the very best effect from it. So this is my Instagram, and I'm going to be Jen when you're ready for me.
Thank you so much, Beth. I know there was a little bit of an issue with audio, but it might just be from reception or something. But I think we had a question on the slides. Are you okay with sharing the slides with people, or
Just said
I think it
the
might
post.
be cutting in and out. Say that again. I'm sorry. I think we might have missed that.
Yeah, I'm gonna post the slides to my Instagram account.
Oh, got it. Okay, which is this? This is the account, right? Cannabeth NH.
Yep.
Got it.
Yes.
Okay. Okay, great. Thank you very much for that. We have a few questions, so I can go back up here, try to take them in order. Kristen is asking, could you speak to CBD for other digestive disorders like SIBO, which is small intestinal bacterial overgrowth, for those of you that not sure what that is. SIBO can be the major cause often of irritable bowel syndrome, things like gas bloating, abdominal pain, diarrhea, constipation. So have you seen that work with either, others, or with, I don't know, with yourself, if you've had gut issues like that?
I have seen CBD work on some people that had too much activity at really low doses. At the high doses, I haven't seen it work, and at the low doses, people were using it kind of as
Low is like less than 25, or what is low?
yeah, like even 2 milligrams, like very small amounts.
Okay, okay.
It's kind of hard to find, but yeah, the really small doses of
2 milligrams.
it.
Yeah, yeah. Mm-hmm.
Yeah, 2 5 milligrams, and I would say that experimenting with it is good. Be mindful that when you're putting CBD in your stomach, it goes into your liver and affects enzymes that process other pharmaceutical drugs that you're on.
Mm-hmm.
So I find it's important to be in consultation with a physician who can review the drugs that you're on and make sure that there's no P450 enzyme interactions,
Yeah, yeah.
and that you're not interfering with the, especially there's a lot of blood pressure medications that work on those enzymes.
Okay, so just watching out. People are on blood pressure medicines and just in general medications. There's
Yeah, it's
actually a
worth
drug.
experimenting
Mhm.
with. I haven't seen a whole lot of success with it, but it's definitely worth experimenting with.
And there is actually a database called the Natural Medicine Comprehensive Database, and that is a good checker for both combination of drugs and supplements, drugs and vitamins, or drugs and supplements. So just FYI. I also just want to say that just for legal disclaimer here, that this webinar does not imply an endorsement of THC for usage other than cannabis for medical reasons, and always consult your healthcare practitioner or doctor before trying CBD and THC. And I think we say this sometimes, but this webinar is not intended, I know for Beth this one, is not intended to diagnose, treat, or prevent any disease or condition, although we know that it's helpful for people and it's obviously been super helpful for Beth. I believe this is sort of is this kind of, what do you see in terms of medically, legally, like when you talk to other doctors about this? I mean, is there some fear of like, okay, this is not really, part of it? I know different states have different laws now. What are your kind of experiences with that?
I mean, it definitely comes down state to state. There's some states that are surprising, like Texas and Utah, where the medical marijuana is prescribed by doctors. So doctors are very aware of dosage and how to prescribe it and everything. And then you have other states that you would think are more liberal, like Massachusetts, where you have to find a pot doc and a doctor that, to get your medical card, a doctor that's kind of outside the regular medical system. So it really varies state by state. It's getting a little better, but the reason doctors have had a hard time talking about it in the past is there was some activity by the DEA to investigate doctors that would recommend THC and take away their medical license.
Oh, okay.
So that went on for like 20 years in California, and that legacy has made doctors a little gun shy about talking about it.
Yeah.
And they're all pretty worried about losing their medical license by talking about it. So once it goes legal federally, that's when we'll get more doctors even being able to be curious about it.
I remember one of the things that you mentioned in your conference that I attended, in the conference that I attended that you were speaking at, was that, hemp is really one of the, I think the oldest plant that's cultivated by humans back like 13,000 years ago. So there's this idea that, oh, it's something that's not, it's been around actually for a long time, and we know that it actually hits the cannabidiol one and two receptors, and definitely with we do see that a lot in our clinic where a lot of inflammation gets reduced with use of either CBD or a combination of CBD and THC. So Maria asks, I know we have to go at one, so let's just make sure we get the questions. Does THC or CBD build up over time? She said that she was taking a tincture daily with a higher CBD to THC ratio, so more CBD than THC. She stopped having panic attacks when taking, oh, I see. She had panic attacks when she took the higher CBD to THC ratio tincture. So I guess it was somehow, maybe there's some time
Too much
thing. She didn't have
THC.
panic attacks before. So yeah, what are your thoughts about that?
I mean, it sounds like she was taking too much THC and getting the panic attacks. Before raising the ratio of CBD THC, I would have reduced the dose and thought, maybe she's just taking too much of
Okay.
the THC.
Okay. So that might
Um,
be. And then that goes along with another question from Judith. What do you recommend for someone with chronic pain from joint hypermobility? It could be EDS or it could be some spectrum of that hypermobility who doesn't want the psychotropic effect.
Yeah, topical application all day long. If you don't want the psychotropic effects and you have pain, then really rub it right into the joints that are bothering you, rub it right into the spot that's bothering you. If you don't get any effect from it, find a higher concentration. And as I said a couple times, I don't know if it came through, but if you can't find a high enough concentration, if you can't find a potent enough topical, then find a tincture and then apply that tincture, an oil-based tincture, and apply that tincture topically. Very frequently, the same companies will have a topical that's fairly weak, but a tincture that is going to be perfect.
Okay, got it. Great. Rita asks, thank you, Beth. Rita asks, can taking either CBD or THC cause any issues with fertility or impact any hormones for women?
CBD inhibits the enzyme that creates estrogen. So if you have any fertility questions, then I would avoid using CBD internally. Externally as a balm, totally fine. But at this point, I recommend that women that are looking to reproduce avoid using CBD vaginally or internally.
And what about THC? Any concerns there? Same thing or?
THC doesn't have those concerns. It's still experimental. So if you take
Yeah.
THC while you're gestating a baby, you're
Yeah.
experimenting on your baby. I
Yeah,
don't
yeah, yeah.
recommend that.
So we do not recommend that. Yeah, exactly. Great. Thank you for
Yeah.
that answer. That's great. Um, yes, someone was saying, yeah, okay, DEA not interested in health. Definitely, there's some, thoughts on that. What is the best, quickest way to get a dispensary card? Would be another question. Any thoughts about that?
So in the state that you're in, call the dispensary that's local to you. That dispensary wants you to get a card. They will tell you how to get a card.
Okay. Okay. Got it. Yes, and I mean, we do participate here at CIH and the Maryland Medical Cannabis Commission. So we have, if you want to know about that, you're a patient here, let's say, you can contact us and we'll let you know about that from our end. For patients that want a card, we require at least a telehealth appointment, ideally some sort of physical exam. So we kind of do it more medical and, just look at, what are your symptoms, examine you, things like that. Maybe look at the possible drug interactions like that. That I think would be a safer way to do it. Oh, I must have forgotten. Sorry, Mark. Hmm.
So some people get confused. You don't need a medical card to go to a CBD store.
A CBD store only, right? But you're talking about for the THC, you
Right.
do. Yes. Okay. Got it. Got it.
When
Yeah,
you go to the
that's good.
dispensary, you need one. But some people think you need a medical card for the CBD store.
Yes, good,
Any old
good.
Joe can
That's
walk
good. So just for the CBD, yeah, you could get that, over the counter, everything. There's topical CBD products
online,
online.
everywhere.
Yes, right.
Yeah.
Okay, what are the different ways? Yeah, so memory. So a lot of people are talking about memory. Let me look at what is the effect of CBD or THC on memory. I think that people want to know about how does CBD and THC affect cognitive function, particularly memory in days after use, but also long term.
So long-term CBD and THC reduce inflammation, and inflammation is the enemy of memory. So long-term, it's good. Short-term, the effects of THC are debilitating on memory when used in a high enough dose. If you use a microdose of THC, a
Mm-hmm.
little tiny splash of THC actually increases your serotonin release
Oh,
and
nice.
increases your memory function.
Okay.
So dose is everything, and
Yeah.
a very tiny dose of THC gives a lot of people a boost. CBD, I haven't seen it affect it one way or the other. It depends on your endocannabinoid tone and if it's going to increase your anandamide. If it
Mm.
increases your anandamide through that FA inhibition, then it will decrease your memory, because that's what anandamide does. Anandamide helps us forget the pain and the stress of exercise, so that like we're not consumed with the memories of how much it hurt to run away from that lion. The
Oh,
next time we
got
need
it.
to run
Okay.
away from the lion, and we go, I don't want to run away from the
Like the
lion. It
bliss
hurt so much
molecule.
last
Yeah.
time.
Yeah.
We don't
Yeah.
have a memory of it because we have
So we
enough
want to
anandamide.
forget certain things. That's what it sounds
Want
like.
to forget
Got it.
certain things.
Got it.
Don't want to forget. Memory is tricky, and anandamide is definitely a molecule worth looking into to understand how memory goes both ways.
Mm-hmm. Yes.
PTSD is another area where memory is not so much fun for people.
Yeah, right, exactly. Makes sense. Thank you. Okay, a couple other questions and then I think we might have to wrap up here, but thank you so much, Beth. Which quality controls on manufacturers, or what are the quality controls on manufacturers? How do we know that content claims are correct? This is a great question.
That is such a great question. Personally, I'm obnoxious and I bring most of my stuff to the lab. So you can find cannabis testing labs in your area. If this is a
Okay.
medicine you're going to use regularly, bring it to the lab, get it independently tested.
Mm-hmm.
The other way to make sure is to go to a dispensary that you trust, that you know is getting their stuff tested.
Okay.
Different states have different levels of regulation around THC testing and what they're getting tested. In Maine, the recreational marijuana has to be tested all the way through, like the solvents and the pesticides and the cannabinoid content, but your medical marijuana in Maine doesn't have to be tested at all. So it's
That's
on
so
you, the
weird.
consumer, to
Yeah.
test it.
Yeah,
It's
yeah,
very weird.
it's
It's
actually
different states.
still a bit of a wild west out there in a way for regulation. I mean, it's
It
not
is
totally standardized.
100% wild west out
Yeah,
there. This industry is crazy to
got to
deal
put our
with. There's a
cowboy
lot of
hats on,
scammers out there.
cowboy cowgirl hats on here. Any products that you
Yeah.
recommend? Are there any CBD products that you recommend that you like that are commercially based? You know?
Yeah, there's a company called Lily Hill in Vermont, and I've actually spent the night up at their farm. They have monarch butterflies everywhere. It's 100% organic. It's a whole plant CBD company that just started selling CBG also, which
Oh,
is
nice.
another cannabinoid people can experiment with. So that's Lily Hill, Lily Hill.
Okay. Okay.
Yeah.
Got it. Great, thank you.
Mhm.
That's great that you have the personal experience with that. Okay, one more, I think. Judith's been experiencing palpitations after taking full spectrum CBD oil gel caps. Could that be from the CBD, THC, or other? I mean, it should be less than 0.3% THC, assuming that that's accurate there.
It should be. I was talking a little bit in this presentation about how we're not exactly sure all the things that CBD can do. It's fairly new. It might be from a high level of THC content in there. I would say the first thing to do is reduce your dose. If you're
Mhm.
having palpitations, reduce your dose. The second thing to do is switch to an isolate-based CBD. If CBD is the medicine that's doing something for you, then the isolate-based should be fine.
Mhm.
If it's still giving you the palpitations, you know that it's the CBD and not the THC, and maybe the CBD isn't a good match for you. CBD also gives me palpitations, and I also get like a little heated emotionally from it. So I personally just don't use it. I leave it alone, and I use really low doses of THC when I need it.
Yeah, and then of course, if there's joint pain or fibromyalgia, different things like that, then topical CBD would really be better because
You
of that.
got it.
I
Topical.
was listening. I
Exactly.
was trying to
Yeah.
listen. That's the one thing, right?
Topical,
And
topical, topical.
that's your take home today. One more question from Abby. Do you
That's my
recommend
take home.
once
Put
you
it where you
find,
need it.
yes, do you recommend once you find your strain, if it's available in your state, to grow and process your own? It's a good question too, maybe.
If
Is
you
that
can
something
grow,
you
I've got black thumb, so I
do?
it's more complicated. Absolutely. Part of the therapy of cannabis medicine can be growing the cannabis medicine
Yeah,
itself.
yeah, yeah. You're
Absolutely.
interacting with the earth, the plants. Yeah.
Yeah.
Taylor's saying always
And
grow
there's
your own. Yes.
the books that I recommend. There's an author named Ed Rosenthal, and he wrote the Marijuana Growers Bible, and he also wrote Beyond Buds.
And
So the
and I think
Marijuana
there's a
Growers
is
Bible.
there are there legal issues in each state for growing, or what's the legal
Yeah.
environment?
Oh, definitely
Let's make
check with
sure.
your
Yeah.
state.
Yeah.
Definitely, because I was a medical patient in New Hampshire for 5 years, and I wasn't allowed to grow my own
So
plants
check
at
your
all.
state.
Uh,
I'm not sure what the laws
check
are
your
in the DC region,
state.
but we have to
Yeah,
just check on
hemp
this.
is I think CBD hemp can be grown in any state now.
Mhm.
And if you're not growing a lot, I don't think that you need, yeah, check with every state. Just check Marijuana Policy Project. They have a really good listing of all of the
Someone is
laws.
Mark is saying legal nowhere for federal law. VA is legal to grow as of July 1st, 2021. I honestly, Jen, we should probably research that. It's just an interesting thing to know about. We are definitely not legal experts here, so we definitely check the laws of your state and the federal government and all that stuff before you grow your own. But it could be helpful to grow your own if that's permissible. So,
Yeah,
but yeah, Mark is saying that the federal law is saying it's legal nowhere. So, I don't know. I guess we should
federally,
look at that.
everything is illegal federally except for hemp.
Federally, okay. So then, in theory, yeah, okay. I
Federally,
think that
all of it is illegal. Yeah,
okay, except if you do like go to the dispensary, of course, and then it's sort of being yeah. Well, that's another
really,
topic for
that's
another time, I suppose. Yeah.
it's another topic for another day.
Right, right. We'll get that topic in. Well, thank you so much, Beth. It was great to have.
We're getting there.
Yes. Well, thank you so much for your time and expertise and knowledge and information. And yes, and Jim is saying, congratulations on your successful health journey. Thanks for all the great information. I will echo Jim on that. Thank you so much, Beth. It's great to see you today. And thank you for all the
My
information. I
pleasure.
know that really helped a lot of people today. So thank you.
You're very welcome.
Actually, I do have one more question. I know we're a little over time, but I'm really excited about this topic. One thing I have as a doctor, right? I mean, I called the Medical Cannabis Commission in Maryland. I mean, there's not any formal training programs for doctors or other clinicians. So how do we learn this, more? I mean, they have some CME, I think, need to look into. What is
Yeah.
the way, like if someone goes to the dispensary, how do they really know? Is it more like with, like you're doing like kind of a trial and error and figuring out what works for you, know some basic things, or is there some resource for either, people to go to or even, professionals that they could consult?
There's a lot of resources out there, some of them better than others. The Leafly and Weed Maps apps are good guidance, and they have other patients on there talking about things. Um, Going on your social media, it sounds like a weird recommendation, but going into social media groups, like Facebook has groups like Cannabis for Crohn's Disease. I think there's actually 3 Cannabis for Crohn's Disease groups.
Hmm.
And in there, you can see how other people are using cannabis and get recommendations for strains and whatnot.
Hmm.
As far as consult, talk to your doctor, do your
Yeah.
research, but it's a lot of trial and error. And be wary that a lot of people giving you advice are trying to sell you something.
Yeah, that's yeah.
And
So I really think that
this is
that's
where
something we
you
do want to
learn.
do here in our clinic at Capital Integrative Health is work on some medical education so we can kind of up level our level of knowledge so we can help more people with this. I think it's just an area it's a bucket that we really need to work on there. But yeah, this is a good kind of starting point. I'm sure I'll be in touch with you on email, and we'll go through some other educational things. One more question. Sorry, are you good for one more question? Okay.
No, you're fine.
Thank
Yes,
you.
go
Thank you
ahead.
so much. Margaret is asking, what is best for sleep? I mean, sleep is one of the most important health factors, so that's definitely a
Sleep is
good.
huge. Yeah. So I have had people use anywhere from 2 milligrams of THC to 100 milligrams of THC to a combination of THC and CBD. Generally, people find that a 1-to-1 combination of THC and CBD is the best for sleep. I personally use THC, and I'll smoke it or I'll eat it. The effect of having too much THC is falling asleep.
Mhm.
So that's so that's kind of
That could be
it's where a lot
helpful.
of people use their cannabis is for falling asleep. And edibles help you fall asleep usually better than other things. The trick is to fall asleep before the munchies kick in.
Yes, that's a great. Yes, I am super curious. Kiona is fun to watch. Thank you. Anyway, thank you so much, everyone, for attending, participating in this. We'll see you next week with Iris and reflexology. But thank you so much, Beth. It's been great to see you, and I hope the Cowboys do well this year as well. So,
My pleasure. Thank you.
all right, thank you so much. Have a good one, everyone.
Bye.
Bye.